The PTA program at CCRI uses a student performance evaluation tool created by the New England PTA Consortium. This tool is used to rate PTA student performance at the midterm and the final of each clinical experience. The first page of the document collects some demographic and administrative information and should be self-explanatory to complete. And I'd like to take a moment to go over some guidelines and the rating scale for the document. So there's two forms of feedback that we can give to our students during the course of a clinical experience. Formative feedback is feedback and evaluation that goes on throughout the clinical experience. So as the student finishes with a patient and you step outside the room and you ask the student, so how do you think that went? And they give you a synopsis and then you provide some feedback to the student. That's formative feedback. That formative feedback is meant to help them grow and learn. The midterm and final grades for the clinical experience on the student performance evaluation form really serve more to benchmark the student's performance at a given point in time and to provide that student with feedback as to what their status is. That status check at the midterm is something that should direct the weekly goals for the second half of the experience. As the student gets their midterm scores, if they realize that there's areas where they have a long way to make progress to get to the expected performance level by the final, that student should be writing weekly goals in those areas and coming to you as the clinical instructor, as that self-directed learner, and saying, I'm recognizing that I have some things to learn on this particular topic. Can you help me plan some learning experiences so I can gain some exposure experience and develop some more expertise in those areas? The midterm and final scores also help to promote discussion between the clinical instructor and the student, especially incorporating the student's self-evaluation scores into that process really helps the student develop their self-assessment skills and help to calibrate and benchmark their own ability to self-reflect on their performance, to know when they're doing a good job, to know intrinsically when they need to reach out and find additional resources to help develop their skills. All right, so looking at this particular evaluation tool here for the midterm and the final, let's roll down here to the rating scale. And you'll see that each of the areas that we grade the student on at midterm and final will be graded using the following scale. The 1 through 4 scale is used to give a numerical rating. A 4 is the highest score the student can get. That's confirmation. And basically confirmation means that the student is functioning safely, relatively independently, that they are making good decisions on their own, and that they're coming to you at the end of the experience or at the end of the patient treatment or intervention and saying, just wanted to give you some feedback, here's how it went, and have a little discussion about it after the fact. So if the student is essentially performing it safely and independently, their score would be a 4, confirmation. We do recognize that in some settings the level of complexity of the patient population may be greater, and as an entry level PTA or a PTA student, the student may not be performing at that or not be able to appropriately perform at that confirmation level. So when that happens, if there are more complex cases that we wouldn't expect a student or a new grad to be handling alone, then a grade of a 4 may also be given in the event when a student demonstrates 90 to 100% competence level as compared to what we would expect for a new graduate working in that setting. So that new grad or the PTA student may still need some assistance from the clinical instructor, but if what you're seeing from our student is 90 to 100% of what we would expect for a new grad in that complex setting, then a grade of a 4 may still be issued. A grade of a 3 means that the student needs guidance. So if the student may need to draw on your expertise for planning purposes before they go in to do the treatment, but yet once they get your guidance, you don't need to be physically present during the treatment that they're administering, then a grade of a 3 would be the appropriate score. Going back to that situation where you might have a patient population that is highly complex And we may not expect a new graduate or a student to be functioning at a guidance level. They actually may need you there physically. If that student is demonstrating an 80 to 90% competence level as compared to what you would expect from a new grad in that setting, meaning you might still have to be physically there, but they're functioning 80 to 90% of what a new grad would be expected to do with that complex population, then a grade of a 3 may still be given. A grade of a 2 means the student needs supervision. So the presence of the clinical instructor in the immediate vicinity is necessary, and the student may need some verbal or physical cueing or assistance from the clinical instructor during the treatment. So for certain skills that our students may not have had a lot of exposure to, and especially on our first clinicals, then supervision may be a very appropriate score for certain skills. And in just a minute, we're going to go over what the actual expected performance levels are for the various grading criteria. A grade of a 1 means the student needs constant supervision. So they need continuous verbal cueing or physical assistance from the CI throughout the course of the treatment. I'd like to spend a minute looking at these other 2 scores at the bottom of the page here, are not applicable and not observed. So not applicable simply means that the objective is not applicable to your actual clinical setting. It may be an intervention that's not delivered based on the patient population that you have, or it may be a type of experience that is not available at your facility. So we always encourage clinical instructors in those instances to take advantage of the NA. We have no expectation that every student is going to get to practice every skill and have every experience at every clinical. So we encourage you to grade the student based on the experiences that are available, and use the grade of an NA, not applicable, if that experience simply isn't available at your setting. And finally, the NO, which is a very important grade on our scale. And this grade means that the objective was not observed to the extent that rating is appropriate. So I'll give you an example of that. If you watch the student perform a goniometric measurement, maybe only once or twice between the start of the clinical and the midterm, well, it would stand to reason that you'd be giving the student supervision during that activity because it's only the first or second time that they had performed the skill. Perhaps they performed it correctly, but you didn't see them perform it consistently enough to feel that a grade of 3 or 4 was justifiable. So in that instance, rather than rating the student a lower score, saying, well, I feel like I'd have to give them supervision for that because I haven't seen them do it that much, so I need to ensure that they're consistent with it. Rather than rating them a lower score because you haven't seen it enough, in that instance, we encourage you to use the rating of an NO, not observed to the extent that rating is appropriate. So our students do need to meet certain expected performance criteria. And again, the only ones we expect you to rate the students on are the ones that you've watched them do consistently. Consistently enough to say that yes, they consistently need supervision, or they consistently need guidance, or they consistently are functioning at a confirmation level. If you can't speak to what they do consistently because you have not seen it enough, then please use the NO, the not observed score. All right, moving down to the rest of the form, we won't spend a lot of time here, but I will show you briefly the various grading categories on the form. There's a spot for you to include a score at the midterm and the final. Professional behavior and attitude is our first rating category. We have a category for safety, for communication and interpersonal skills, further subdivided by verbal, nonverbal, and documentation. Data collection skills, subdivided into various categories. Various interventions, critical thinking skills, organizational administrative skills, and finally the educational presentation, which is the in-service that the student should be delivering to you toward the end of the experience. We do ask that our students try and get an in-service topic picked out early on in the experience, certainly by the midterm. We love for them to get input from the site on what topics may be of interest to your staff, so that the student can be providing a valuable resource as they do their in-service. We do ask that students use at least 2 peer-reviewed research articles so that their in-service presentation is evidence-based. If the student chooses an alternate type of an in-service that does not warrant a formal presentation to your staff, then we ask that that in-service topic be pre-approved by the course coordinator at the college before they move forward with that topic. Moving toward the end of the form, there's an area at the midterm and the final where you can categorically rate whether or not the student's performance has been satisfactory or unsatisfactory in any given area. Very important that we provide the student with fair and honest feedback about their performance, and if a skill is truly unsatisfactory at the midterm, then I would encourage you to provide that input to the student so that they unquestionably recognize that there's a deficit in that area, and therefore they can work to plan learning experiences and write weekly goals for themselves in that particular performance area. At the end, there's a place for you to include some overall comments about the student's strengths, any areas that still require improvement, as well as any areas that did improve over the period between the beginning of the experience and the midterm, or the midterm and the final of the experience. So the last thing I'd like to show you is the place where you will go to review what the expected performance level is that CCRI has set for our students for any given experience in any of these given categories. We ask clinical instructors certainly not to use those expected performance levels as a guide to scoring the student, but rather to review those expected performance levels at the very beginning of the clinical experience, so you can get a mindset as to what the general level of expectation is. I'm going to jump over to the course syllabus. Now, this particular course syllabus is for Clinical Education 1, but in the student packet that comes to you in the postal mail, you'll receive the course syllabus that goes with the particular clinical that the student is coming to you for. So looking at this as an example of Clin Ed 1, as we scroll down in the syllabus, the last portion of the syllabus is the course objectives. And we have the course objectives written in our syllabus reflect every one of the performance grading elements in the student performance evaluation. So you can basically look at that student performance eval, and you can look at the syllabus and say, well, here's what the expected level of performance is in professional behavior and attitude. Here's what the expected level of performance is for safety. And as you can see, these are all relatively high scores, starting even with Clinical Education 1. These are areas that we see as non-negotiables and need to be in place before a clinical experience even begins and throughout the course of that experience from day one of the first clinical. Going down, you can review what the expected performance level is for every grading element. And again, I would encourage clinical instructors not to keep this out while you are grading the student. I really want the grades that you give our students to be reflective of their actual performance. But reviewing this document at the start of the clinical experience will be a great guide for you to give you a mindset of the general areas that the students should be achieving in each one of these categories. Last thing that I'll mention on the performance evaluation are the comment sections. So we love any comments that you'd like to include for us, but what I will say is that a time when comments would be essential would be if a student is scoring below the expected performance level in a given area. So when a student's scoring below, or certainly if there's a theme or a performance issue, we really need to have documented clinical examples of where the deficiencies exist, things that you have observed the student doing to justify the score that they're receiving that's below the expected performance level. And certainly if you have a student that has any performance issues, please call the course coordinator at the school as early as possible in the clinical. We'd rather hear from you earlier and often rather than later and less often. The more that we can be involved in helping support you and the student, we can really help to remediate and offset any problems before they become bigger problems. And we can also help with creating a plan, a remediation plan for a student who might be struggling. We can also help to write goals for that student if there is a student performance issue, so that the student knows in no uncertain terms exactly what is expected of them to pass the experience. And when these situations come up, they're few and far between, but when they do come up, as the faculty, we like to be able to step in and help guide this process to relieve that burden from you as the clinical instructor. And again, these situations are few and far between, but whenever there's a question, we encourage you to reach out early, reach out often, and draw on our resources and expertise to help guide you through the process of scoring the student, of handling any issues or questions that might come up along the way.